Guys, I'm I'm having a total meltdown about getting the vaccine tomorrow. Not until this year did I even get vaccinated for the flu shot. I never even had the flu. So if you know me, I'm like super OCD about medical stuff because I've had so much trauma. And I'm scheduled to get the Moderna vaccine tomorrow at 2 p.m. and I'm kind of freaking out. I've had so many problems with big pharma and being poisoned by Cipro and just so many things. So I'm dying to know if anyone wants to jump in the video and tell me if you've gotten vaccinated. I would love to know that. Hi, Luca. Hi, Janet. Hi, Lady. I just want to say hi to everybody. David, Miranda, Madi. Oh, Madi's on here. Please do not take it. Should I explain to you how dangerous this is? Yeah, see, that's the thing. Like, everybody I know. Let's see. Let's have David come in. Let's see. You give me your best vaccine pitch. Also, you guys can tip me now. I have the tip feature. They just gave me that tip feature, which is pretty cool. Hi, David. Is it David? Is he there?
How are you? I'm driving back from getting my second shot of Pfizer now. So I saw you
You
post. I
are.
thought I'd jump in. I already got it. I got it about an hour ago.
Okay, so tell me how your first experience was and welcome. Thank you for coming on.
Thank you. The first one was good. Yeah. I mean, it was. It very kind of little pinch you feel was nothing. And then I woke up the next morning. I forgot I had got it, and then I like scratched my arm and felt the Band-Aid, and then I remembered. And I'd
Hmm.
say it was maybe a little tender, but nothing I wouldn't even say sore. And then this one, I couldn't believe how I didn't even really feel it. It didn't like hurt the shot. So it was easy. Now I'm in only an hour in, but so far so good.
Good. And like, do you normally get vaccinated for things? Because I'm not an anti-vaxxer, but I don't normally get vaccinated for things. So I'm just curious. Like, do you normally get a flu shot? What's your thing?
Don't get a
Uh-oh.
flu shot, but certainly got vaccinated when I was a kid for any polio and all that stuff. But haven't gotten the flu shot. So, but I thought this was important to
Gotcha.
get for sure.
Yeah. Did you ever have COVID or anything? Never got it?
No, I did not get it. So, fortunately, yeah, have not gotten it yet. How about yourself?
Yeah, so I have never had the flu. I don't really get shots. I've had vaccines, in the past for other things. I've had meningitis. My immunity's pretty incredible. I almost died from that. Someone just said I work in the field of a vaccine. I want to talk to them too, but I'm glad you're okay. I'm glad you're not having side effects. I know everyone's freaking out because of Johnson and Johnson. Um, and now the CDC is saying that they're gonna like put it back out. So it's all very new. And for me, it's always suspect because the flu shot took like years to figure out, and they've rushed this one. So my biggest fear is the long-term side effects.
Yeah, but I'm not sure. I know that the delivery method is technology that they've been working on for a long time.
Hmm.
So I feel just like for all the research I've done about it is that it's not like they just rushed something that normally would have taken 3 times as long. They were creating technology just for this.
Yeah, and it's
What
interesting.
and
What do you
oh
say?
sorry.
No, go ahead.
I was just gonna say too that I just got it. Um, I wasn't in. I live in San Luis Obispo County, so it's rural. I moved from LA a few months ago.
Oh, you're breaking up. Uh-oh, he's breaking up.
I know I hit a dead spot. I should be good now, hopefully.
That's okay.
Can you hear now?
You were saying?
Oh, I was just saying that I live in San Luis Obispo County. So it's it's more of a rural area, I'd probably describe it. So, I don't know. I probably would have been more of a rush and gotten it a month or two ago if I was still in LA.
Mm-hmm.
But, I still think, to get back into it. And I see my mom often, and she's in her 80s. She just turned 80. So, got to make
Wow.
sure she's good.
No, my parents have it. I've been with them since I moved back from New York. And so many people, even in the chat, are saying I wouldn't get it. And so many people I know are holding off. And so what's your biggest reason? Was it your biggest reason your family?
I
Forget.
think it's, I think it's the right thing to do for our fellow humans. I think, yeah, for my mom, certainly, I get people want to be, careful. Yeah, so I just think, look, if you're around a lot of people, I think you have to think about others. And I think if you feel strongly about not taking it, make sure you wear a mask. And I'd say just be extra careful. But I have a friend, good buddy of mine, and he's not sure he wants to take it. I feel like I've got him close to taking it, but who knows? I have a
It's
long
a
talk with him.
personal decision, and people are, now you can only go to Europe if you've been vaccinated. And the thing is I'm about to go to, sorry, the shadows. I'm about to go to Hawaii and then go to LA. And those are really long flights from the East Coast. So that'll be the longest flight that I've been on in over a year, well over a year. Um, and so breathing that recycled air is already like you can just get sick normally, right? So breathing that recycled air on the airplane is a concern, and being on a plane for that long. So there's so many millions of Americans that are getting the first dose and not getting the second dose. And doctors are saying that, like, even though it's 83% effective for Moderna for the first shot, the second shot is 93% effective. So the flu shot is like 74% effective. So it's just very interesting. For me, I'd rather just get one shot than two because it seems ridiculous. But then it's like, why get it at all? Because the whole point is to be fully inoculated and go through both steps. So for me, I feel like it's kind of like an all or nothing thing. If I'm going to inject myself with this rat poison or whatever the hell I'm going to be putting in my body, I might as well get both of them. I'm like very overwhelmed by that. But I appreciate you coming on. I'm gonna have a couple other people come on. And nice to meet you.
Likewise, and I know you're going to make the right decision, whatever that may be.
I'm gonna figure it out. Thank you so much, David.
I have no idea how to leave, but hopefully you'll send me out. Or maybe
I
I do
have
that.
no idea how to do it. Okay. So we just had David come on. He was telling me that he got the vaccine. Another update is Instagram is now allowing you all to buy badges. So if you see at the bottom of your screen, you can support me, you can support Quarantine But Cute. I've been doing this show for like this is not my normal show. I'm just coming on live to talk about this because I'm so concerned about the vaccine. And I've been very hesitant to get it. And I'm available to get it tomorrow at 2 p.m. Moderna. My family has been vaccinated. They didn't have any major side effects. They just felt fatigue, and they're older with a lot of medical problems. So that made me feel good knowing that. Um, but because I have a lot of PTSD around medical issues that I've had in the past, I'm really hesitant to get it tomorrow. So what does that mean? It will not change your DNA. I'd rather live in the dystopia. Luca, will you come on? Luca, if anyone wants to come on, feel free to come on. Um, Also, just very excited about badges and the fact that you guys can support me now. And literally, can you support my whole life? Can you pay my rent? But it's really cool. Instagram like only gave it away to 50,000 people. And I guess I don't know if they selected me at random. I don't know how they did it, but There's badges now, and you can see it at the bottom, and you can tip me, which is so cool. Um, Someone just said, I totally have PTSD too, Janet. I get it. Janet, do you want to come on and talk a little bit about that? Anybody that wants to come on the video, I think I can have 4 people at a time. So I understand, Janet. Broadway for Life said, I trust Moderna and Pfizer compared to Johnson& Johnson and AstraZeneca. Totally. And so, oh, someone just supported me. Oh, Luca supported me. Thank you. And I can see the badges by you. That's so cool. So yeah, so when I'm doing these lives now, you guys can tip me, which is super exciting. And it's like a very um like rare thing now, but it's so cool. I guess only like 50,000 people on Instagram were able to get this thing where you can, sorry, I'm not using my words because I'm like reading everything that everybody's saying. But it's really cool. So like people can tip me for my content when I do my lives. And the parameters are it just has to be over 2 minutes and it has to be your content, which not not a problem. Oh my God, my friend just texted me that she got the older and younger part. Oh my God, my friend just got that's really exciting. My friend just booked a huge role. I'm super excited. She's an actor too. That was cool. I just got that in real time. But yeah, I appreciate all of you being here because I'm having like major anxiety about this. And I've had so many problems and medical issues in my past. And just it's not that I don't trust doctors, it's that I don't trust pharmaceutical companies. And when you rush a vaccine like that, it's scary. So with someone like me who has sciatica and neuropathy and a bunch of other shit because of like back issues and sciatica, I called my doctor in New York and he's a neurologist. And let me let Janet in. And he's a neurologist and he told me to get it. So let me get Janet in here. I'm freaking out. Janet.
Hi. Oh my God. I'm like, let me find a filter real quick because
No, girl, you're nice to meet you. Nice to meet you. Tell me your
thank
thoughts
you.
because I
I
am
mean,
panicking right
I'm totally with you. I think for me it was like this roller coaster where there was like times where I had a bunch of people that I knew got it and they were fine and I'm like feeling good. I'm like, okay, I'm gonna get it. And then I would hear something
now.
online and then I'd be like, fuck, I don't think I want it
Yeah.
anymore.
Yeah.
And then it's like then my grandma would everybody would get their second dose and they all did good and I'm like, okay, I'm on the train again. And then you hear the Johnson and Johnson and I'm just like, Jesus Christ, can we like, so I did get my first one. I got the Pfizer one and
Okay.
I was well, I before the Johnson and Johnson stuff happened, I obviously wanted that one because it was just one, and so I didn't want to
Yeah.
deal with the like two shots. Um, but at the same time, like I know that there has been more research with like Pfizer and Moderna. Well, specifically Pfizer, I think it's been a little bit longer, so there's been more research. And then I saw this thing that it said Moderna and Pfizer, like the side effects, which are the normal things we've been seeing, like the feeling sore or like a headache, and just like the typical side effects that people are having.
Yeah.
Moderna had, I mean, they both showed up with them, but Moderna had a higher percentage versus Pfizer. So, and luckily, or I went to Stanford to get my shot and I got Pfizer and I didn't get any. I mean, I had a sore arm, but
Moderna, wait, let me back up. Moderna had a higher percentage of what?
like for example, migraines, let's say there was, let's say with 20%, I mean, I'm making up numbers, but let's say with Pfizer, it was like 22% people claim that they got it. And then with Moderna, it was like 29, so it was
Mm.
just slightly higher. um I mean, and of course everyone's different. Like there's some people who get Pfizer and they get like, this more symptoms, like, but I just recently saw some friends that I know got COVID and it hit them bad. Like where
We're
I'm just like, oh my God, like that to me is more scary.
than the vaccine.
Yeah. I mean, and I've had vaccines in the past and I don't have allergies, like huge allergies, and I've never
Right.
had a reaction to vaccines. I don't get the flu shot, but all my other vaccines and like the Tdap, like just, what is that other one we had to get for like your cervix or like your
Oh,
woman
yeah, HPV.
HPV. I think that was
Yeah, I guess I did get those too years ago.
yeah, so I've never had bad reactions to
Yeah, I
any of
haven't had bad
those.
vaccines ever.
Yeah, so that made me feel a little better because I know if you are somebody who does have had those issues, I think there's like it's a little scarier because you don't know. But I mean, what's scary to you?
The long-term side effects. So, like Empathy Within just said, it's not what happens now, it's what happens down the road. That is always my biggest concern because I'm fully convinced that when I was poisoned by Cipro, it caused my sciatica a year later because I never had sciatica.
Hmm.
Um, like I had back issues, but this is different.
Oh
It's,
God, sciatica is the worst. I had surgery once and they gave me like the real pain meds, for it. And I'm like, I needed these medication for when I had my sciatica because that was bad.
yeah, Empath Within just said, yeah, it sucks. I'm sorry. She said she posted a link. Can you DM me that link? So like I'm all about like holistic and stuff. But then at the same time, if I've got a crazy headache, I will take ibuprofen. Like so
Yeah.
I'm in a very weird space of like don't do it unless you have to kind of feeling. And
Yeah.
then people that are like, I'm not doing it no matter what when it comes to like popping a
Well,
pill or whatever it is.
the long-term effects of it, like I wonder because we obviously have to get the shot again, like the flu shot. So if it were to be in our system for like ever and change things, then why would we need to keep taking the vaccine? Like
Yeah.
there's certain vaccines that you don't have to take again. You usually take them once in your life.
Yeah,
So
true.
I don't know.
But
I
you're gonna have
wonder.
to take every year supposedly, like the flu shot, because as coronavirus, morphs into its other variants, you've got to keep up with it.
Yeah. Yeah.
I know it's weird, and it's like, again, I never, ever, ever um had the flu shot until this past year and never had the flu.
So you was with the flu shot that you had that side effect with your sciatica, you said?
No, 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 no. It was Cipro.
Oh,
The
okay.
medication Cipro. I had crazy side effects, suicidal thoughts, depression. Like after taking two pills, it's got a black box label warning. Cipro, like, is so deadly
What is Cipro for?
at many different things. I literally had it for traveler's diarrhea.
Oh,
I'd
okay.
come back from like Mexico. Honestly, I should have just taken Imodium and would have been fine. But my stomach was like upset for like a really long time. And I was like, something's wrong. So I went to urgent care and, they ask you like your medical history. Have you been depressed in the past? I'm like, yes. So it's like, why would you give me Cipro for that?
That's so.
Like, it has a black box label on it. That's crazy.
Oh, the
Um,
one thing I will say back to the COVID vaccine that I can't remember who told me this, but they said to up on your vitamin D and C before and like in between. Well, the first shot, I feel like you'll be fine. You're
I take vitamin D every single day and I
yeah,
drink coffee
but they
water. So,
need to up it. So between the first and the second to like up the dose that you normally take. So if you take 5,000 units, I take like 10,000 every other day, and I'll just do my normal. And
really?
vitamin C, they say that if you up it, the side effects to it lessens it. I mean, something. Oh, somebody's saying something. Yeah,
Yeah,
but
she's definitely very holistic, the empath within. So yeah, it's true. We're designed to fight off viruses, build your immune system, and yeah, that's so true. But you know, the body couldn't have fought off the plague. Like there's
yeah.
You
Yeah,
know
my
what I mean? There's certain
friend
things
who
like,
got COVID, she actually has like she has asthma, but it's never been like a huge issue.
mm,
And she got COVID and it hit her in 3 days. Like it like just went straight to her lungs. She couldn't breathe. She's been in the hospital for 2 weeks. Her lungs collapsed, and like she's been had as a healthy immune system thus, till now. Like
oh,
she's a healthy lady, and it just hit her. She didn't get the fever. She didn't get like the a lot of the typical side effects from COVID. She didn't get any of those,
right.
and it just went straight to her lungs. And I mean, she did not. She's been wanting to get the vaccine and wasn't able to get an appointment, even though she had a note from her doctor saying that she has asthma, and I think she was pre-diabetic as well. But she wasn't diabetic; she was just pre-diabetic. So it didn't. She wasn't able to get an appointment, and then that whole thing happened. But
No. Well, so, but your overall take, and by the way, Broadway for Life, I tried to add you in. It says it's waiting for you to accept it. So once we get off this video chat, we'll try. Oh, there you go.
Yeah,
Hey,
I figured it out. I was like, oh my God, this is insane.
well,
um,
okay, wait. So I just want to quickly finish up and keep speaking to her really quick.
yeah,
But overall, you think people should get the shot?
yes, that is my
No,
side view.
I think so. Yeah.
both of
I,
you can answer. Sure.
I mean, I think the what is it? What's that saying? The not the risk. The every it just like the risk is greater to me.
The
And
reward is greater than the risk of not having it, you mean?
Mhm.
Or,
yeah.
yes. I know.
Yeah,
Well, and then the risk is also greater with not having
Yeah,
the
that's what I'm
vaccine.
trying to say.
And
Yeah.
and also like, for me, like I want to travel and not it gives me so much anxiety just to think about going anywhere.
Oh,
Even
yeah.
for having, I mean, for me, I'm a makeup artist, so I'm doing
Mm.
people's makeup with no mask. Like, how am I supposed to do
yeah,
makeup with the mask? So
Yeah. Get
I'm
it.
doing all the things, like I'm double masking, I have my shield and all of that. But even then, so I have to be in people's faces without wearing a mask. And some models don't care. They be traveling, they be going out places, like they're young. So to me, it just gives me a peace of mind. And it like, even after getting the first vaccine, I was definitely nervous waiting those 15 minutes, after they give you your shot. I was like, oh shit,
You got to
like,
calm yourself.
yeah. But then the next day I was like, oh, who cares about the second shot? If I feel like I need to be in bed all day, like I was just nervous about having an allergic reaction. And then after I was fine, then I felt so much better. And even like the week after, like I just felt like this anxiety that just like left. Although I was really anxious, I will say, like leading up that week of my shot.
I'm definitely freaking the fuck out. Like,
Yeah.
I'm getting it tomorrow.
So, quick question, which one are you getting? Do you know?
Moderna.
Okay, so I actually work in that field with vaccines right now. Like I'm a process engineer for them, and I've learned a lot about the chemistry side of things because my thesis is like anti-cancer drugs. So I'm like an organic chemist as well.
Oh my God, I'm so happy you're here on there.
Yeah. So I was going to answer some of the questions and some of the like myths that people tend to have on the vaccine in general.
Okay.
So coming from my standpoint and like my understanding of the science behind it, a lot of people worry about how quickly the drug or the vaccine was made in general. That's not necessarily the case. We've known about SARS for years. And then we've been doing testing and studying and stuff like that, but it's never affected humans directly in the impact that it had now.
Mm.
So basically, what a lot of companies did in order to get them FDA approved or get the output quicker is everything got prioritized specifically towards COVID. You didn't have us worrying about other diseases or illnesses at that point. Like even now in my industry right now, with us being a COVID site where we're making a vaccine for COVID, we get priority over every other drug that is being made at all. And we get money and influence on that as well. So when we order things like a stainless steel tank or different things like that, normally it's like a 30-week lead time. But if you tell them that you're COVID related, you get it in 9 weeks.
Wow.
It's like everything is being prioritized specifically towards COVID. And most people who do make vaccines or drugs to treat things, they normally have to go through a process of finding money at the same time to be able to make these vaccines because everything costs in this world. So in the case of this, with the way that we had all of these different people pouring in money into it, it's like they don't have to fight for money anymore. It's literally just given to them and they're like, find the cure. We need to fix this now.
Okay, so let me just stop you for a minute.
Mm-hmm.
That's sort of debunking that idea of how is this vaccine possible? It's been developed too fast.
Yes, exactly. It's because it's being prioritized over everything else. So then on top of that, for me personally, I trust Moderna and Pfizer's vaccine specifically. The reason why is because, I mean, even if you go and look at the ingredients of all of these vaccines and like what's put in them, and you look up each ingredient and you see the pros and cons of those ingredients, you'll notice there's similarities in the way that you're seeing these side effects that are occurring. So in my case, when I went to research, I noticed that Moderna and Pfizer don't have the same ingredients that Johnson & Johnson or AstraZeneca would have. So in this case, Johnson & Johnson and AstraZeneca have been seeing the blood clotting and all of these different things. But there's papers on like PS80, which they talk about as one of their binding agents within their molecule. PS80 has already been proven to have issues and cause issues within the human body. There's multiple sources, 7 or 8 different research papers, all talking about this specific molecule and how it can affect the body. So that's where you're seeing a lot of these crazy side effects coming up out of nowhere, where they're like, oh my God, like, don't take it anymore because of that reason. And they're trying to make sure that even when these side effects occur, that they take the time to analyze what exactly is happening. But at the same time, their formulation process should have been taken into account of the ingredients that they're using. So a lot of the time,
100%.
So in this case, AstraZeneca and Johnson & Johnson didn't. But that's also what gives it its thermal stability. So normally with Moderna and Pfizer, they have to be stored at -80. Otherwise, their drug dies. And they can't.
With Moderna and Pfizer, -80.
Yeah, or -40, because it has to stabilize that molecule. And if they can't stabilize it, it dies and it doesn't have the same effect that it normally would have.
So are you telling me that if I went to a pharmacy, they would know ahead of time if they have a bad batch or not?
Yes, they should know ahead of time. Like even now when we're releasing drug, we won't release it if it has certain things involved in it or if it's out of spec in any way. We won't release the drug.
Okay, great. So if, let's say, here another crazy example. If the drug is released, it's cold stored, right? As it's freezer stored.
Yeah.
As it's being transported, and then somehow, do they have a detection if it heats up too much?
Yeah, so they actually do have trucks with thermal temperature readings and probes within the truck as well to make sure that that drug is going to stay at the corrected temperature. So that's half the reason why there's been news articles and stuff like that about nurses like taking drug out and then being like, oh, we can't use it now because it already reached a certain temperature and it has to be used in a certain time frame. So that we've lost like dozens and dozens of doses because it's heated up too quickly.
I mean, it's how they recognize it, but also horrible for the weight.
Yeah, like because we're.
But what else? When I went to go get my vaccine, they don't just like, you have to wait. So I don't know. I can't remember how many they're in the batch, but like for them to open it, you have to have like they had. Well, when I went to Stanford, they had about 15 or 20. I can't remember. There was a lot of nurses there, just like
all lined up to go.
They're all lined up, so you had
fast.
You had to wait for everyone. So it's like they put you 15 at a time, and then you go and wait, and then they wait until they all clear up again. So I guess they have to have everyone is doing the shot at the same time. So it's like when they take it out of where they're keeping it to be at a certain temperature.
Yeah, you have a specific time frame that you have to be injected the vaccine after.
I was in line. I was the second one, and they let somebody go. I saw the last person go, and I'm like, dang it, I missed it. And I was the second person, and I saw these like available nurses, because you can see people getting their shot and then going to sit to wait. And I'm
Right, right.
thinking, why aren't they calling me? I had to wait till there was like 20 people
Yeah,
behind me
they
so
want
they
to.
can send us all at the same time. So that's the kind of it's a nice thing about, like, because I was worried about that too. Like, how long has it been sitting there? Like, you know?
That's like
Yeah.
synchronized swimming. They're like they have to be like on point. This is a fascinating conversation.
And
Wow. So
so,
go ahead. Yeah.
so then the other thing is I saw somebody talking about it'll change your DNA, and like that's like a major thing that everybody's like panicking about. But it's like when
Why
you
have I been hearing that from multiple
I
people?
don't understand it. I don't know where it came from
Your
because
DNA cannot be.
no, when you look at regular cells and how we create proteins, none of it is in the nucleus. Your
Yeah.
nucleus is where your DNA is. It's folded up and crunched up and your nucleus. So when we are injecting you with this messenger RNA, what it's doing is it's going into the cytoplasm, which is nowhere near the DNA of the molecule because it doesn't go into the nucleus of it, of the cell. And what it does is it reads through your ribosomes, and that's how you start to manufacture that protein. And so it's never actually touching your DNA at the same time.
Wow. So why are people then, in your opinion, being, and tell me what your title is?
I'm a process engineer. So a process engineer and an organic chemist that actually works in the field of creating drugs and whatnot.
I
So
can't believe I came onto this chat. I'm like so
yeah.
grateful.
Yeah, no, I've been like hanging out because I'm also like trying to become an actor and whatnot too. And I've been doing film work. So I met you on Clubhouse and then I like followed you and was like,
Yeah, we
okay,
all met in
let's fix
Clubhouse.
it. Yeah.
Yeah. I'm
I was-
so glad. You guys have to DM me after this because I
yeah.
want to post this chat because I think it's really valuable
Yeah.
for people. And so why do you all think, and anyone can answer this, why do you all think there are these conspiracies about, well, why are there conspiracies about
Well,
anything?
there's
But why
always
are
conspiracies.
there conspiracies about it changing the DNA? What would that,
Mhm.
how could that have started? That's a huge accusation.
I think it's a big thing when people go through like biology and whatnot. Like if you don't go super into depth, like for me in college, I had to like go through all of this and biochem and understanding amino acids and how they form and everything like that. So when you don't go into depth, really a lot of people just think, oh, it goes into your body and it touches your DNA and then attaches and then that's how you get proteins. And that's not
Right.
necessarily the case. Proteins are made in a completely different section of the cell. But I don't think most people realize that a lot of the time.
But
they just hear it goes in the cell and that's it.
But you know, the conspiracies, I just feel like with social media, like every conspiracy just becomes so blown out. And then you already have this anxiety and this fear around something that's different, because anything that's like not familiar is going to feel a little scary, you
well,
know?
we fear the unknown. That's just how our brains protect us from dying.
Yeah, you know, so I just think because it's out there and there's a lot of more people out there that are anti-vaxxers, and like, you know, you just hear so many things. Somebody posted the empath, they said it would be interesting to bring a doctor in here that creates vaccines. Am I wrong?
So,
but I don't
doctors
think
don't
doctors
create
vaccines.
It's all chemists that vaccines. So I personally know the person who's made AstraZeneca's vaccine, and I know a couple of others as well. So it's usually your process engineers design the entire system for mass production and how this vaccine is made in general, like all the excipients and stuff. But you have a formulation chemist who specifically designs that vaccine. And then doctors more look at clinical trials more than anything. So doctors go specifically to putting it in the body and seeing the response. They don't
help them figure out how to treat their patients depending on what their pre-existing conditions are.
Exactly. Yep.
Look at me knowing things.
I heard you
feeling better? Are you feeling
better about
amount of anxiety?
Yes. Yeah, you guys
are helping. I was like, let me explain real quick because I was like, please no, because I know there's a lot of fear out there behind it, and I've like gone through and I've studied a lot of this because I'm like, in my lifetime, like even with my thesis, like I'm trying to learn new targeted drug delivery methods for cancer
Right.
to make that better for people. So they're not having all of the same crazy side effects and all the like things that happen with free circulation of drug in the body.
That's
So
amazing that you're
yeah,
doing that. That is incredible work. And what do you do, my dear? I didn't even ask you.
Me?
me or okay.
Oh,
I
me,
forget. What's your name?
Janet, like Miss Janet.
Janet.
I do makeup.
Oh yeah, makeup, makeup, makeup. I forgot.
Yeah.
But no, the thing that you brought up about makeup, I did a photo shoot with my agency this past weekend, and everybody on set was wearing masks, but some of the models, weren't. And I tried to have mine on as, I'm an actor, models and actors. And just because it's kind of like, it's hard because they've just done our hair and makeup and we can't,
Like
Well, you
smudge it.
could at least
but
you could at least have a shield.
yeah, so I just kind of separated myself and just really distanced myself from everybody else.
Yeah.
Um,
It's crazy
during
to me how they have, I mean, I'm here in the Bay Area, and every job that I have, the people that are going to be without masks, they are staggered. So if you're there as a talent without a mask, nobody else is around without a mask. Like, you're the only one. So if anyone's more at, like, in danger, I guess you would be the least. Well, I don't know. I think it's
Well,
both ways.
no, because the other talent were like near me without a
Yeah,
mask.
yeah, that's what I'm saying. That's crazy to me that there's multiple people that they have on set that are maskless, because unless they're really, some productions are really strict with COVID. Like, they
Mhm.
have a COVID compliance officer, they have
Yeah.
testing on site. But even when
Well,
they
this
are,
wasn't a TV production. This was a photo shoot for New Looks.
mhm.
So, and like, I love my agency, and like, I have to sign something, that says, like, if you get COVID, it wasn't from us, kind of deal.
Ah,
But
Yeah.
I, my own due diligence, and I, when people got close to me, I just kind of like backed up.
Yeah, some people are so, like, at shoots, you'll be like, dude, you're without a mask. You're just like nonchalant, or people, their mask will be falling off and they're not even mindful. Um, I mean, sometimes I just say, like, oh, I'm at risk, so do you mind? Like,
pulling your
Yeah,
mask up or
I mean,
something.
let me ask you this: being a biochemist, is that what you said?
Mhm. Yeah, I do like all of science area involving drugs and whatnot. So,
So when it comes to COVID, say this is maybe a weird question.
hmm
Say I was on set on Saturday, and
hmm
and I have COVID, but I don't know it right now.
hmm
Okay, and
hmm
I go get the vaccine tomorrow.
hmm
Will that help?
you'll still get COVID.
Mm.
So they've actually done studies where people have gotten the vaccine. The vaccine is meant to help stop COVID from attaching to your cells and injecting its like viral load into you pretty much. So when people have gotten vaccinated, they're like, oh, like I can't get COVID anymore.
That's not true.
But if you already had COVID and you went to get the vaccine and you come out, you're still going to have COVID. Like you're still going to lose your taste. You're still going to have these issues because your immune system hasn't learned to fight COVID yet at that point.
And that's why when you get the first inoculation, it's 10 days for
Yeah,
your body
for
to.
you to hit that 60% level of protection or whatnot.
And with Moderna, I'm hearing that after the first shot, it's 83% effective. And then by
Yeah,
the second shot, it's 93. Is that correct?
it's 95. Yeah.
well,
95.
So,
and you
so
know
they
what?
usually tell you to wait 2 weeks after that second shot or 2 weeks after the first shot to actually see that immunity build because your body still needs that time to produce that protein and your white blood cells to learn how to fight it in general.
Correct. And then it's a 4-week wait.
hmm
And so
In
basically,
between. Yeah.
I'm getting my first one tomorrow, Moderna. Then
Yes.
my second one will be after so then I'm flying to Hawaii. So at least
Mhm.
I'm 83% protected.
Yeah. By the time that 10 days is up or whatnot after the first dose.
Right, because I go May 21st, and then I go to LA, and then I come back the 7th, and then literally on the 8th, I'm getting the second one.
Yeah.
So
And then
how, with the Pfizer, what's the percentage of protection with the first shot with Pfizer?
I believe the first shot of Pfizer is like 60 to 70, but usually by the second shot, you're fine. You just have to wait the 2 weeks and you're at
Yeah.
95%.
I mean, I do know that when you get the Moderna, I think it's higher in dosage. That's
Hmm.
why the percentage is a little higher of like the migraine,
Hmm. Yeah.
or there's like a bigger spacing out because
Hmm.
the first dose is higher.
Yeah.
It's
So
more.
it's totally dependent on concentration too of the viral load. So like even when we're making AstraZeneca, we get some batches that we all have to like go for the same percentage technically. So normally when we're making it, it's like 4.5 ppms, which is parts per million of the actual virus. So depending on that concentration and how the strength or purity of that vaccine, you'll get different dosage amounts because of that. So that's why they, in the beginning, when they start clinical trials, they test for that and see where your immunity is going to lie at the same time.
So let me ask you this. There was a guy that got the Moderna shot, and since
Hmm.
his first shot, his headache has not gone away.
That I am not even sure about because that's super weird.
That's very scary. Those are the stories that I think when you have PTSD, you latch onto
When you
because
see that, oh no.
you think when your trauma has happened, because the rarities of the things that have happened to me are so not normal. Like I had meningitis and almost died. I've
Mhm.
had bacterial infections. I've had sciatica where it hit me so hard that like the right side of my right foot is still numb a year and a few months later.
Mhm.
And just like all the cases of the things I've experienced are so rare, but as far as a vaccine goes, I've never had an adverse reaction.
Adverse, yeah. So, and I mean, I also was listening to that too and seeing those like side effects. My mom is actually a breast cancer survivor and just got both of her vaccines not too long ago.
Wow, I'm happy for her.
And she has been completely fine afterwards. So it really just depends, I feel like, because sometimes the adverse effects that we might see might not necessarily be from the vaccine. They could be from something else that's going on within us. So
That's
that's where it
the
gets iffy.
body.
And I think that's where people start to freak out because they're like, oh my God, this can happen. But it's like, did that actually occur because of the vaccine or did it occur because you got something else?
Yeah. Well, like, yeah, if you think about it, like, we've all will be in a year be getting vaccinated. But imagine if COVID never happened, people will still be getting things happening to them in this 1 year with
Yeah,
or
with,
without a vaccine.
Totally.
yeah.
So, but because everyone's getting a vaccine, then there's like, wait, was it the
They're
vaccine
tied
that
to
caused
that.
it?
Hmm.
I mean,
They're what? Say that again, because you
they're
broke.
tying their illnesses or anything that's occurring to them straight back to the vaccine because the vaccine is the big change thing that
Guilt
everyone's
by
expecting.
guilt
Yeah,
by
it's
association.
like it's the scapegoat. It's the vaccine. It did it to me. Like, like,
It's just, it's such a personal thing. It's like sharing your medical history with somebody. It's such a
mhm.
personal thing.
Yep.
Um, and so there's no like right or wrong. There's just like science and facts.
Hmm.
And you
You
have to like
that.
make a choice if you want that fact or not. And then even the facts that we've seen, they've had to change you know,
Hmm.
their answers to it as well, saying, oh, well,
This actually occurs or whatever. But and I mean that's
oh,
what science is though. It's repeatability. It's repeatability. When we change a claim on something, it's because it's been repeated multiple times and we've seen that same answer come up. So it's not like we put out an answer and we're like, that's set in stone. We're like, it could change if there's more data that comes along behind it. And that's the very important thing about science and why a lot of things that when they become fact, it's because it's been the same multiple times over and over again.
so what is something then that you would say to help? I mean, you've already eased my anxiety, both of you, hearing both of your stories and then hearing about your friend who's very ill. And I'm so sorry. I hope she um, comes through it. Send us in the
she finally was able to go home today, and she posted her long story on Facebook. I didn't even know all the details,
Mm-hmm.
but I think she's still in oxygen. But I think her scans, like her CT scans or her whatever they had to do, it showed that her lungs were doing what they wanted them to do. So thankfully, she will be okay. She just won't be able to work. I mean, she's a makeup artist, so there's no way that she could work.
Yeah,
And
that
she's young, right?
man.
Yeah, I mean, she's like in her late 30s, maybe early 40s. I mean, she
Yeah,
looks,
that's young. I'm in my
yeah.
late 30s.
I say
uh,
young. I'm in my mid 30s. But if you do get your shot tomorrow, you should just go on Clubhouse, have a bottle of wine ready, and then the title can
just
be
leave
something
me
like
the us.
not about talking negatively about the shot, like
Yeah, no, because because also at the same time, so I think I heard somebody or I read somebody talking about, what was it with the vaccine? It was just on my mind, and I was like, wait a second, let me just stop this too. Um, Involving, let me scroll. I was like, let's see.
In school, I think, I don't like, I'm not just going to do something for clickbait. You
Mhm.
know? Like, I'm not just going to open up a room on Clubhouse and be like, should I get the vaccine? Yes or no? Because it's less controlled than this conversation.
Yeah, you might have a lot more issues and
It
things to
becomes,
who's coming up with this, like,
it becomes super crazy depending on who you bring on stage. So this was kind of incredible to have you two on completely randomly, unscheduled, and that you work in the vaccine space and you work in a space where you're super close with people, and have a friend that's gone through it. It is definitely, a touchy subject. And so she said, no one truly knows. Just happens to be after immunization, much like what happened to the war vets 5-8 years ago down the road. I mean, that's so true. Like PTSD and the side effects people experience later on. I understand the hesitancy.
Mhm. And
Um,
so I wanted to say, I remembered what it was. We were talking about um, your immune system and like building it up and whatnot. And yes, it to a certain extent, but also at the same time, a vaccine is built to build your immune system. It's like it wouldn't be called a vaccine if they were just going to give you a drug and be like it's the cure all. The vaccine is meant to help it boost your immune system against a specific thing. And then the flu shot. So the flu is a bit different than COVID, honestly. Like we're seeing multiple strains coming up now and like all of this stuff. But the genetic material of what COVID is staying the same. It's just becoming more contagious and whatnot. So with the flu, the
mhm.
attachment site is what changes. And that's why we have so many different vaccines and we're predicting what the next virus is going to look like based off of that attachment site.
So when it comes to, as we know, the variants are going to change, the
Yeah.
shot will yearly.
Yes.
Do you think there are going to be, based on like the science, just right now? I know you
Yeah.
can't.
So based off of just the
But
science, what I know now about COVID, our attachment site isn't changing. The actual virus within the molecule is changing. So right now, so like we learned about like, okay, our body's replicating the cleats or whatever of the molecule, right? And then that's what attaches to your cell and then it injects the virus or whatnot. So what most of the messenger RNAs are doing is it's teaching your body how to, well, one, it's not even teaching your body. Really what's happening is you're creating the proteins of the spike that's on the virus.
wow.
And so with it, when it's doing this and you're putting the messenger RNA in it, your white blood cells are basically learning how to respond to it. And then they memorize, okay, we know how to do this, this, and this. And anytime we see it, we'll attack it quicker.
And
Then
it's a small enough amount to where it can't hurt you.
yeah, because if we go too high in viral load, you're going to get all the same symptoms of COVID and it's going to wreck you even worse. So that's why that's all controlled in the way that we dose it to you. So in the case of this, the cleats are not changing. The actual attachment site that is attaching to cells is not changing. They haven't seen it change yet. And that's what we're banking on to be able to get people to be safe from the COVID virus. With
Now,
the flu, the
mhm.
cleats so say if we said, okay, COVID is the flu, right? The cleats of the coronavirus, if it was the flu, that's what's changing. So your attachment site to the cell is changing. And depending on that attachment site, it can basically hide itself from your immune system. And so that's how people are getting sick. And we're trying to predict this ahead of time to try to dwindle that flu virus down. So
Wow.
that's where it's coming from. So a lot of our vaccines for the flu are coming from China because they've already seen a variant, and we're assuming that we're going to get the same variant, if not similar.
Wow, I'm just trying to take in all the information you just said. Um, so when it comes to, okay, here's a question for you.
Yeah. Mhm.
I'm going to a very small pharmacy, which for me, that means there's way less room for error when it comes to administering the vaccine. I almost said the virus.
Mhm.
What were to happen if someone accidentally gave someone the second dose instead of the first?
So they're not actually different. It's the same thing. It's just the first dose and the second dose should be the same drug product, and they should have the same formulation. Basically what's happening is when they give you the first dose, they kind of like issue your body to realize that this is going to happen, and then they give you a bigger dose so that way your immune system's like, oh yeah, we can fight this and we're going to make it stronger.
Oh, so it's the same exact chemical
Yeah, it's the same.
water in the syringe.
Yes, it's just the dosage that's different. It should be the exact same drug.
So the dosage in the second one is more than the first one?
Yes, as far as I tell right away, I definitely
So
would
that
believe
makes sense as to why people get hit more with the
the
second.
second time, not the first one. Yeah.
But the idea is that when they do that, by then you've built it up, the protein's up, right?
And your body's learned to fight it. And then when they give you the second dose, they make your immune system learn to fight it even more.
Because you have
Better than it originally.
because it's got to be compared to what it'd be really like getting in real life.
An actual dose, yeah.
Oh my God, I feel so smart now.
I know, right?
This is in
It's a real touchy subject for sure, like you said. And I know a lot of people that are like, oh my God, like I don't want to get it. But it's like, I got to the point where the real thing that clicked for me to realize like, hey, like if they wanted this to kill people and they wanted the vaccine to kill people, they would just let it run amok. Why would they even put any attention on coronavirus at all if they didn't want to see people die? Like why create the vaccine? Just let people run around. People are going to start dying left and right. So
well, that's what's happening in India. That's what's happening.
exactly.
It's so crazy.
But,
and also the other thing is like, for me, what kind of made like had brought a peace of mind was like there are people all over the world everyone's going through this, the whole world is, you know, and we can't just say, oh, it's here in the US that they're corrupt or blah blah blah, like pharma, like even people in other countries don't like the way Americans do it, and the fact that other countries and like, you know, their scientists are being a part of this, it's like everyone in the world, like they're all their energy is going to this vaccine and to COVID. So it makes me feel good to know, like, you know, it's a vaccine that is really being prioritized by the whole world, you know, and it's not like what is it called? The people that have to approve stuff to happen, ingredients, stuff. Like they have to get other people from other scientists, like they have to hire out all these other people to prove it. It's not just the FDA, like, oh, like it's shampoo.
Being like, yeah, send it.
Yeah, no, like they can't do that. They have to have other people sign it off, you know? So it's like, it's a lot harder than just.
And then something else that I can offer to that same effect is the fact that with money and America being like a first world country versus a third world country. And I totally like honestly wish the world would be like, let's just help each other stop. But in this situation, in the way that we are, a lot of the other countries that we're seeing are having more issues because they don't have the same resources that bigger countries have.
India is begging for oxygen right now.
Yeah. So like India is begging for that, but also it's like they don't have the same standards to be able to manufacture the drug, or they don't have the same rules and set of rules that they have to use to receive the drug. So like we have the FDA here that usually is like, we have critical processing parameters that we have to follow. And if we don't hit within those parameters, we're not allowed to distribute the drug in America at all.
But the
And,
vaccine isn't FDA approved, so that's where all these
but we
conspiracies are
have the
happening.
so it's not FDA approved, but also at the same time, these critical parameters are still met. So if
Mm.
we fall out of any of the specs that we should have, we're not allowed to release the drug whatsoever.
Even though it's not FDA approved.
Yes, and it was the same issue. That's the whole reason why when Johnson and Johnson was like, "We're going to send all these doses to California," they mixed it with AstraZeneca and they immediately chopped the entire thing. So they didn't get as much drug as they wanted. And it's for that very reason, because once you start mixing between compounds and whatnot, it gets dangerous. So they were like, "We're going to completely nix any of this." And that's when the company who was actually manufacturing both drugs basically said, "We're no longer manufacturing your drug, we're only manufacturing this drug," because of that mix up. So
Wow.
it's very aggressive with the way that they are making sure that there's no cross contamination between drugs as well. And so you have the FDA who makes sure we still file with the FDA. Like we still have to file the drug with them. And like for a plant that is global and we make drug for not only America, but like Latin America, or we make drug for the UK and the Europe and whatnot, they all have their own standards to the way that drug needs to be made. So Europe's EUA or whatever is their RFDA. They have a specific acronym for their drug association, the way we do. And with theirs, they have tighter parameters than America does. And then you also have like Latin America, where their parameters are way looser than Europe and America's.
Right.
And that creates issues as well. And you don't know really what you're getting depending on the country that you're in. And that's because certain countries are more specific about what we're going to give to our people.
Do you think
them being need to vaccinate?
Right. And do you think moving forward, I mean, I'm sure there already is, there has going to have to be a global initiative, almost like the UN, right? Where when this happens again, because time has shown us that it will, even if it's 100 years from now, when the next pandemic has an outbreak, there has to be that, hitting the red button and all the protocols coming down for the world, because that wasn't in place pre-COVID.
Yeah, no, I definitely think there's a lot more precautions put into play now, just experiencing this type of pandemic occurring. I mean, this isn't like it just shut one country down, it shut the whole world down for a while.
And it still is, though. It still is. And
everybody's still on edge about it constantly because of that. And I'm like, I honestly think like if we've experienced something like this at this point, I'm like, there's probably so many precautions that should be put into play at this point involving this. And I mean, even if something did occur like this, I bet you it would show up just like how it showed up now, where everyone's going to be like, "Oh, prioritize this because it did shut down the world." Like, I honestly look at this as being like one of the biggest viruses that's actually shut down the world. And we don't know how long, because we've heard about like Ebola and all of these other crazy diseases spreading, but we didn't shut down the same way we did when we saw COVID and was like, "Oh my God." Like, how
it never came to America.
Yeah, like the minute it hit America, it was like panic.
Isn't that sad though? Isn't that sad that we have only cared about our country for so long?
Yeah, and we got loose with the way we were doing things, because normally and then also the thing with COVID and why it was able to do the damage that it did and shut down the world is because we no longer had a virus that kills immediately, but it gives it time to incubate and spread, which normally most of our crazy diseases would kill off before they could actually spread. Right. So in this case with COVID, it was causing damage to people, but it wasn't allowed to, but it was causing damage to people, but it was also allowed to spread just as easily. And it wasn't like full death. It was, "Oh, we're going to like destroy your lungs. Oh, we're going to do this, this, and this, but we're not going to kill you off at the same time." But then we've seen all of these deaths come from it too, because our bodies don't know how to respond to it at the same time. So that's what put everyone on edge immediately when we saw this virus even show up, is because it was like, "Oh, wow. So this will actually incubate for a long enough period to spread and then cause side effects and long-term damage after it's been in the body."
And you're speaking to the long haulers here.
Yeah. Like, so most people who do get COVID, some of them might only lose their taste and their smell, and they're fine. But also others are having like lung scarring and everything else from it and can't breathe and are put on intubators and all of that stuff because their body can't fight it the same way that somebody else's body could. And even then, they're saying that a lot of people who have gotten COVID and only didn't have really any side effects or the process during, they had long-term side effects later on down the road where they were like, oh my God, all of a sudden I'm like actually having issues, even though it wasn't seen right away.
From having COVID, yeah.
Yeah.
And so with asymptomatic people, they've not seen any.
Yeah, we honestly, that's the scary part about it too. You can be completely asymptomatic and not even know and spread it to people. And then they get wrecked because they like, and I
You
hate
mean the
having,
people spread it to get wrecked.
yeah. So like if you're asymptomatic and you're a carrier of COVID and you go around somebody else, they might not be asymptomatic. They might respond negatively, extremely negatively compared to somebody who's asymptomatic.
Totally. There's
And
part
that's
of me that
scary.
wonders because I've traveled so much, not so much. I didn't travel for almost a year when COVID hit. I traveled, let's see, COVID hit March 2020.
Mhm.
I knew about it in February. I stopped riding the New York subways into
You were
February.
like, avoid everyone.
Well, because you live in New York too, right?
I live in New Mexico, but all my family's
Oh.
in New York. So I told them all, I was like, don't do it. Like, stay home.
So
Uh,
literally February 27th was the last day I rode the New York subway.
Wow. Yeah, no, I just had went to Colorado actually, which was wild. So I went to Colorado for a concert. And as I was leaving Colorado went into full shutdown. And I was like,
Yep.
like,
I was
oh my God, get us out. Like it was bad after that.
Yeah, I was in Puerto Rico. And then Janet, I want to know where you were, but I was in Puerto Rico and I got a call from my best friend and uh he literally said, Lauren, Broadway shut down, don't come back. Like go
Yeah.
home to Atlanta. So that's what I did. Luckily my apartment had been paid up for a few months. My roommate had paid. And I found someone to sublet it. And then that person like skipped out on rent. Eventually someone broke into my place. Like all this crazy shit happened.
God.
And I ended up just deciding to give up my place, even though it was a 2-bed, 1-bath rent stabilized apartment, which is like unheard of. And even now, even with the way rent has dropped, there's nothing like what I had. But there were issues with it. Like there's, and I just realized like if an apartment defines me, I have bigger problems.
Mhm.
So I came home and I've been at home and with family and sometimes losing my mind, sometimes just being grateful and mostly being grateful that I have a roof over my head and have the privilege to have had a second home to go to.
Mhm.
But that was a very scary phone call. I mean, Broadway's never been shut down in the history of Broadway. So when your best friend calls you and tells you that Broadway's about to shut down, it's like,
What is going on? The world's
Yeah.
ending.
what is that?
Yeah, very much so.
So yeah, someone asked me, am I having second thoughts? I'm always going to have second thoughts about any medication or vaccine. That's just how I always am. Again, I never had the flu shot until this past year, had no side effects with the flu shot. I know COVID is nothing like the flu, nor is the vaccine for it. But I guess what I'm saying is I have hesitancy with anything.
Hmm.
I don't trust a lot of things, just like in general.
Yeah, no, I totally
So
agree.
it's not uncommon for me to question. I've always been the type of person that questions. But Janet, where were you when all this happened last year?
Oh, I was just here in the Bay Area. I had fractured my knee. So I had knee surgery like end of 2019. So I was like not fully recovered, but I was able to like go to work. I just had a little limp. So I wasn't really doing much. Like I was home.
Not that happened to you because that's horrible, but I had the sciatica attack December 2019. So I had just been leaving the house only to go to physical therapy or the gym in New York to swim. So I was already in my own mini quarantine.
Yeah.
And then went to Puerto
Getting
Rico
knee
to
surgery. I couldn't even go anywhere. But did you get acupuncture for your sciatica?
I did, and chiropractic care, and honestly, like I've been okay. I've kept it at bay for a year. I haven't seen a chiropractor. I haven't. I've had like a massage here and there, from my friend at her house, but like I haven't really had to get too much medical care because I've been hiding out in the woods and just kind of like stretching and
Yeah.
trying to eat right, even though I like totally gained the quarantine 15 and then like lost it and then gained it back. So that was fun.
Yeah.
Um, but you know, I've always had issues with my back and it affects my weight, it affects my mental health. Sciatica sucks. But it's much better. Like I couldn't, you know how like when you're standing sometimes and say this is your foot and you lift up from the pads of your foot to lift your ankle to lift your back heel up.
Uh-huh.
Like
Mhm.
I couldn't do that a year ago.
Wow. So you
And
couldn't wear heels, I would imagine.
oh no, I can walk. It's funny. I can walk better in heels.
Oh,
I
well,
think
because
it's
your foot's like that when you're wearing heels.
Yeah.
there's a weight distribution. So if you look, hold on. So if you look at my foot, the dog's right here. If you look at my foot, it's right here. It's like this is numb on this side.
Oh man.
I can, like feel it, but it's got like some numbness.
Yeah.
So that's sucky.
That's crazy. My
But it was
sciatica
way,
was also my
it
sciatica
was
was also really bad, so I had to get an injection for the inflammation because it was so inflamed in that area. Uh,
yeah.
and then acupuncture really helped, but mine didn't go as far down to the foot like yours did. Mine was just like almost to like the knee, like the back of the leg. Um, and the chiropractor, I mean, I would after that, like I would see the chiropractor at least once a month just for adjustments because I tend to go to the right more. So it like my hips
Mhm.
kind of like the nerve, it would hit the nerve. So that's what was affecting it. So going to the chiropractor just kind of helps the adjustment just so it doesn't get off balance.
Yeah, my chiropractor actually moved from New York to Atlanta and I can't find him now. I try to call Dr. Mike. He's amazing. He had this practice called House of Chiropractic in Williamsburg. And it was such a pain in the ass to get on the train and go for an hour to there and back. And so he's in Georgia somewhere. I've got to find him. I need you, Dr. Mike. Um, I need to find him. But yeah, chiropractic definitely helps release it. I do stretch daily and I do drink Kangen water and stay hydrated. So like I drink anywhere between 32 and 96 ounces of water a day, but Kangen water specifically. I mean, they give that to chemotherapy patients. I don't know if you know about it. But Kangen water is amazing, alkalized
Yeah.
water. That's my whole other business. And someone just said restorative yoga. Yes, restorative yoga is a game changer. I've been slacking lately on my full stretch routine, so I definitely need to get back to that. But stretching, chiropractic, acupuncture, I am about all of that. So it's super huge. But I want to thank you all so much for being here. It definitely eased my concerns. There's definitely like because I do have the neuropathy, I'm like super scared that
Mhm.
the vaccine's gonna get injected and then like my leg's gonna go numb. Like
I
that.
So to answer that too, I don't think it'll make your leg go more numb. Sciatica's kind of different too in that way because your sciatica is specifically messing with your nerves. And
Mhm.
so when you had your sciatica, your nerve was pinched, and that's why you're losing the feeling. It's not because your body was like, yeah, just end it.
Yeah, no, right.
like
So I
just
still
cut
have
it. Like it's done. Cut it off.
I have pinching on my S1. That's what it
Yeah.
is.
Yeah,
Uh,
and that's where a lot of your nerves are coming from. I don't think you'll get any like sure, if the vaccine makes your body swell, which I personally don't think will necessarily happen, then yeah, maybe it'll get worse, but I really don't see it getting worse. Like I think it's is where it is because of the way that it's pinched.
Yeah.
yeah.
And also if I did get, I forgot, I just remembered, my back did feel a little sore the next day,
Mhm.
but not to the point where it was like terrible. Like it almost felt like how I feel like when I work for a full week and I just feel a little like soreness, but it wasn't. But then I remembered, I'm like, oh, the vaccine is supposed to make your joints feel a little, because your joints might feel a little like
Achy.
tired and achy. Like you just
Mhm.
kind of like the feeling like, oh, I just need a hot tub or I just need to like lay in bed and relax. Like it's just,
I have hot tub.
Well, look at you, girl. You got all the things
Hot tub, and then is it okay to take an ibuprofen?
Yeah,
afterwards. Yeah.
I've seen people take ibuprofen or Tylenol beforehand. I don't know if you would want to take ibuprofen just because it's kind of a blood thinner too at the same time, but I know Tylenol.
You could take Tylenol like right after your vaccine, just pop just in case. I mean, the first vaccine you won't really get. It won't be major.
Tylenol, ibuprofen, isn't it?
Yeah, but you could take it afterwards. Because it takes a while for the arm to feel sore. Like it took at least 6 hours, 5 to 6 hours for me to feel it. And they tell you to, well, the girl that gave me the shot, she just said to massage it and to move it around.
Yeah.
So it's like arm circles. So they kind of
So
give you the shot. It's almost like on your shoulder. I was thinking it was going to be more in my arm, but it was like my shoulder. So I just was doing arm circles.
Really?
Yeah. Not
it's like
there.
right here, the top of your shoulder. Like
That's the worst. I'm so sensitive there. My skin is so sensitive.
So honestly, okay, also from my perspective, because I also got vaccinated too, the first shot I did not feel as aggressively as the second one.
Was it Moderna?
So the first one, like she stabbed me and I was like, is it done? Like, did you do it? Like, and I was like, and I came out of it and like, yeah, my arm got a little bit sore, but like the moving and the massaging helps. And then the second one, I definitely felt it more than the first one.
What was it, Moderna?
I had Pfizer's.
Pfizer, and then
But both
you,
my parents got Moderna, so.
You felt the pinch, or you felt when they were putting it in?
So like first shot, when I felt the needle like go in, I didn't even really feel the needle go in. It just hit me, and then I felt the injection, and I was like, and it was already out of my arm by the time I looked, and I was like, did you do it? Like, did something?
see, that's what I want.
Like,
Yeah, that's
the first one I didn't really feel at all. The second one, though, I definitely, for some reason in my mind, mentally, I was like, this needle is longer than the first one. I swear. I just wasn't sure. But as she stabbed me, and I was like, and then I was like, okay, you gonna take it out yet? Like, get it? Bye.
I didn't even look. I just, I felt a tiny little pinch, like the needle, like it's like barely.
Yeah, I feel the pinch more on the second one than the first one. Like the first one, I didn't feel it.
I have a question. Are nurses our pharmacy people that are going to be distributing this, are they nurses?
They should.
Yeah, they should be. They should be qualified to do this.
They have to be. Yeah, they have to be nurses.
Well, I'm in like a podunk town in North Georgia, and I'm going to this little pharmacy. I'm a little scared.
You'll be fine. I'm pretty sure. Because I know that they have been hiring a ton of nurses too at a lot of the vaccine distributors for that very reason.
Yeah.
Where they're like, we need nurses to be able to administer this, or they have to go through training to be administered they have to go through training to be verified to administer the drug in general.
Yep, because I went to Walgreens for a flu shot, and but the person didn't look like a nurse. They just looked like they worked at the pharmacy, and I was like,
so they're required to have training and certification to do it. So
okay, can you hold my hand tomorrow?
Yeah, we'll be.
Yes. No. Like if I was there, I'd be like, yes, let's go.
I would have a joint ready for you. Like, here, you just hit it, girl. Okay.
Well, what I'm gonna do is I'm going to take 2 tablespoons of CBD honey. It's hemp honey, and it's pain, and then I will see how I feel. I just am praying that it all goes well. And look, I'm a hypochondriac. Okay, so that's why I haven't gotten really that sick in my life, because I wash my hands like a motherfucker.
Yeah.
Like like pre-COVID.
Yeah, you're like, get out of my way. I mean, they've actually said that they released a study on other like viruses or illnesses and stuff like that. They said that we've gotten the flu to practically nothing just by washing our hands constantly and freaking out over COVID, that they're like, we've seen like a significant decrease in the amount of cases of flu and different things like that.
Yeah, I mean,
like,
wash your damn hands.
Like,
well,
so
and also like
take that into account.
Like, kids can't be in school, and I feel like kids are the ones that bring it around a lot of the
Usually
time.
pass it, yeah, because parents will send their kids to school anyway, even though they're sick, and you're like, can you not do that, please? Thank you.
Yeah. No, I'm just kidding.
Yeah.
I love children, but yeah, that's what she was saying. We see no flu this year because everyone's wearing masks. But see, like, think about Japan. They've been wearing masks even just as fashion for forever. you
Yeah.
know.
But we've also started washing our hands a lot more because I've definitely noticed, I think a lot more people have gotten to the point where they all have hand sanitizer in their car and they're all washing their hands constantly because nobody's like, I'm not getting COVID. Wash your hands.
Yeah, like I mean, and I again, like I'm a huge CBD advocate. I don't want to have to get on Tylenol or
Mhm.
ibuprofen or any of that, but let me
Yeah,
tell
no,
you,
totally fair.
if the pain is enough and that CBD is not working,
You're like, you got to do it. I feel
I'm
that.
gonna pop that 600 ibuprofen. Okay.
Yep.
So anyway, we someone said we have so much to learn from them. Oh yeah, that's why there's
Like our
blue
blue
regions in the
region.
world. So I can speak on that actually for a minute. So there's 6 blue zones in the world. One is in the Ukraine. There's Nosara, Costa Rica, where I go to a lot. There's Okinawa, and a couple others. And Okinawa is where Kangen water was created. And blue zones are places where, for anyone that doesn't know, there's less pollution, there's better water quality and food quality, and people tend to live longer lives.
Hmm.
So that's what sort of got me into the whole Kangen water thing because my best friend was drinking it and selling it in Hawaii, and we've known each other for 15 years. And I was like, I need to drink better water.
Like, let's do this.
I
Yeah.
So I did it and then became a distributor, and I'm drinking tons of that water before tomorrow. If anyone
Hmm.
wants to know about Kangen water, they can go to my
What's
page.
the? Oh, well, I'll go to your page. Because
Yeah, yeah,
I remember hearing about it. I mean, I don't buy like soda or like I drink
good.
mostly water. So because I stopped buying like juices and things like that. I mean, I buy wine, but I started buying like more like the fancier water that has like electrolytes and all of that. So I, you know, will spend money on water. But
Yep.
anyways, I'll look on your website. I was just
Yeah,
wondering like what the average is monthly because I remember someone told me and I'm like, oh, that's expensive. I don't have all that money to just like here you go.
is $5,000, but it lasts for 25 years and has over 68 uses, and we have a completely chemical-free home
Mhm.
because it's all based on pH level. But you can pay 180 a month. You can finance it with no credit check. That's a whole other conversation. I need to do a live this week on my page, Devour Kangen, but I can email me and you can finance it. Like it's very simple and it's amazing. And like I have 2 machines. I use one as like a loaner for people in the local Atlanta area, and then I have one at the house, and then I have the shower head, which is the Anespa, which will filter out the chlorine. And 99% of your tap water has chlorine in it. So if you don't have a house filter, you're showering in chlorine.
Yeah.
Oh,
I
yeah.
just don't have like the other thing is I don't have much space because I have roommates, so there's not a lot of space. And I
Oh,
take
it's not big. It's a 12 by 12 by 12 inches on your counter.
Oh,
Yeah, it's not big. It's not big. Do you want to see what it looks like?
sure. But it has to
Okay.
be right next to the sink, yeah.
Yeah, it has to be next to the sink. Hold on. Wait, get down, Rex. I gotta get my lazy ass up. But I'll show it to you really quick. Hold on. Do 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 do. Okay. Okay, you ready for this magic?
We're ready.
This is it.
oh wow. Yeah, that's not.
So
So what's clean? What's the difference between clean and the other water?
so this is not alkalized water. This is just regular water that without an electrical charge.
With it all removed or whatnot. Yeah.
This is still clean water, meaning the pH level is at 7. So it's not alkaline, but it's not acidic.
Yeah.
So
Does it
it's
have chemicals removed though as well?
yeah, this takes
Okay.
out the filter here, it takes out the chlorine
Mm-hmm.
and sediment and stuff.
So
But yeah.
what's the maintenance on that? Like when you have that, like what is the
Yep. So you can get it cleaned once a year, send it into the company, and they'll send you a loaner. And then once a month, I clean it with citric acid.
Okay.
Once a month, I clean it with citric acid, and you just pop this baby out. And this is the electrolysis enhancer. This is what makes the 2.5. So this creates hypochlorous acid. Hypochlorous acid kills COVID.
Okay.
So we use this This is like what you'd use as your bleach or your hand sanitizer.
To
You can
wash your hands and whatnot. Yeah.
Yeah, comes out here, and you can use this to gargle if you have a sore throat. I mean, there's over 68 uses. The 8.5, I use that for coffee. I use this for soups and stews. The 9.5 to drink. I feed my animals the 8.5. This is this is what you
Oh,
use
wow.
to tone your skin and also wash your plants. And because when you turn the spigot on, the top one, this also creates the acidic water will come out of the bottom, but
Mhm.
this will create the 11.5 extreme alkaline water.
Mhm.
And basically the extreme like alkalized water will pull off all the sediment and pesticides from your tomatoes and stuff
Okay.
and
Wow.
all your fruits and veggies. So this will clean your food as well, but it's not the 2.5, it's the alkalized water where it doesn't say that here, but it makes 7 different pHs. And so you clean it once a month and you go to e-cleaning and you follow the instructions, and it's just citric acid that you clean it with. So it's about 5 cents a cleaning. It's incredible. I mean, we haven't bought plastic bottles. We reuse our bottles here. You know, this is, you can see that the
Mhm.
11.0 is in here, greaser. So this will clean off your oven, like all the disgusting things. I mean, girl, I could talk about this forever, y'all. But it's awesome. And honestly, I haven't gotten sick since I bought it. I also don't get sick a lot in general because I'm, like I said, I'm psycho about like washing my hands and stuff. So if you want to know more about Kangen, you guys can hit me up anytime. But you know, they do give it to chemotherapy patients or cancer patients when they're going through chemo.
Mhm. Yep.
I don't know if you've heard that, but yes.
Yeah. No.
They Yeah. And you know, it's just great water. So, I
Yeah.
mean, look, it's wash your hands, it's be safe, get the vaccine if that's what you want to get. And for me, I guess I'm just going to do it because I'll tell you this. I went to Miami like a month ago and I was completely paranoid the entire time.
Oh,
Yeah.
I bet. Yeah.
It's full paranoia. Honestly, when I wasn't vaccinated yet, and I'm an essential worker, so I still had to go to work. I was still panicking. I was like, I can't do this. Like, can I go home? Like it
It
was bad.
it was horrible. It was horrible. And I didn't truly it's not like I could connect anyway because people are being, you know,
Hmm.
hesitant, right? And I wasn't with
Yeah.
strangers or anything.
Hmm.
But you know, like I just couldn't fully be myself. Like travel is scary because you're in this weird like world of your own, feeling almost like you're ignoring people.
Like you're isolated because you're like, please, just in case you have COVID, don't come near me.
Yeah, it's this like travel bubble that you have around you that's
Yeah,
invisible,
I
and
definitely felt
you don't
that.
know how much stress that's putting on the body, like subconsciously, like it's all manifesting in the body. So I was
Hmm.
actually more stressed on that trip, more
Yeah,
relieved when I came home. So now knowing that I'm getting the vaccine,
you can
um,
feel more at ease, but still be protected. Like,
exactly. But look, I appreciate both of you so much. I'm gonna
of course,
post this video. This was such a great conversation. Obviously, let's talk on Clubhouse. I'll probably
yes.
give an update live after the vaccine tomorrow. And I appreciate everybody who supported me and bought badges. That's so exciting to buy badges now in my live
Oh, no.
to support my my broke ass. So thanks.
You
Um,
you got this. You'll be
You got
fine.
this. You're gonna be fine. You got this. You're gonna win tomorrow.
you guys are amazing. All right. I'll talk to you soon. Thank you so much for stopping by. I appreciate all of
Bye.
it.
Bye.
Bye, everybody.